Okay, so welcome back, Jim. I just want to brief you and let you know that during today's session, I will be taking some notes and just documenting some important information to keep for myself. So during our last session, we were talking, um, and as we were ending the session, you brought up your feelings of depression and anxiety, as it relates to several things such as like housing, your diagnoses, food, and a few other things. Do you want to elaborate some more about that today?
Sure. So, my housing situation is still pretty tight right now. Um, we talked about how there was a lot going on. I was staying with my sister, but me and her boyfriend were clashing, and I sort of stay at my boyfriend's dorm, but that's not permanent. So I do need some assistance there to figure out what's long term goals.
Um, so talk to me a little bit more about you staying at your boyfriend's dorm, because what I'm hearing you say is things are rocky at your sister's place. What about the dorm, or is it the dorm or your partner that makes you feel safe or welcome there? Like, is there something different that you would rather be there?
Well, it is more of a safe and welcoming place. It's just not really the most convenient because he does have a roommate and he's cool about it. Like his roommate is not always in there. Like he stays with his partner some nights, so it's just a safe, comfortable space for me to be, opposed to all the chaos at home.
So what I'm hearing you say is when you're here and at this dorm, you can get away from all the chaos that you have going on in your life or at your sister's place.
Yes.
Okay. Um, so I do have some housing resources that I can connect you with. Um, the way the system works here, you would have to stay in a shelter for a short period of time, and then they would connect you within a housing program that best fits your needs at this time. Is that something you would be interested in, or can I provide you more information on that?
Yes, I'll be interested in that.
Okay, so I'm going to go in and I'm going to print off some information about locations where you can go to locate a bed or a shelter that's convenient, and that works well for you. Um, what other things did you want to discuss as it relates to your anxiety and depression?
How to better honestly juggle it all. It's difficult for me, like, just on a day to day, even really processing it, especially with just everyday life. So just if you have any other ways to, I don't know, just help me through it. Like it's like everything's just so chaotic. So it's one of those things, like it's top of mind because how could you forget about it? But I try not to really think about it. If that makes sense.
So when you're referring to it, are you talking about your diagnoses, your HIV diagnoses?
Yes.
Okay. Um, have you ever considered a thought log or have done a thought log in the past with another provider or therapist?
No, I haven't.
So a thought log is similar to like a journal or a diary, where you're experiencing these feelings of anxiety and depression. You just take a moment and you write these thoughts out. And it will really help if you could like date them and preferably timestamp them. And that way we can work on coping skills so that when you're experiencing these feelings, you write them out to release them. And then we can also go over some mindful activities that will allow you to feel more at ease, and to feel like you can cope and maybe get some rest during these times. Is that something you would be interested in doing?
Yes.
Okay. Um, and I just want to go over a few things before I go more into the thought log. What are some things about your diagnosis specifically um, are most troubling for you? Um, is it medication adherence? Like, are you having issues taking your medication? Um, is it understanding transmission, your viral load, your CD4 counts? Like, what exactly is it are you having the most trouble with?
It's kind of like a bit of everything. So Um, I don't know all the ways it can or cannot be transmitted. Um, and I do like have a hard time remembering to take my pills every day, especially
Okay.
because it's so new. So it's like even if I set an alarm, I still might be doing something at the moment, and then I forget, and then I'm like, oh crap, that whole day went away, and I'm not sure like what do you do in those scenarios? If I skip a day, should I double up the next day, not take it at all? And then like you said, well then it all kind of plays into each other because then it's like, now is my viral load going to be up? Am I going to give it to my partner? It's just a lot. It's overwhelming.
Okay. So, what I'm hearing you say is that essentially you're on a pill because you take the medication every day.
Yes.
Okay, so you're taking an antiretroviral therapy drug. Have your doctors discussed the new injection we have available called CAB,
No.
or also known as Cabenuva? So CAB is a newer medication used for HIV patients. Instead of taking pills every day, you come in every 3 months and you get an injection. Um, so we can connect with your provider to see if that will work better for you. I do want to give you a heads up and be completely honest with you. CAB does not work for everyone, but it's worth giving it a try.
Okay.
Um, and as far as how HIV can be transmitted, so there's a lot of myths going around about how HIV can be transmitted. Um, so let's just start with ways it can be transmitted. It can be transmitted through blood, semen, preseminal fluid, vaginal fluids, rectal fluids, and breast milk. It cannot be transmitted through kissing, hugging, shaking hands, sharing objects, sharing food or water. So I know there's a lot of misconception about those things. So if you were ever nervous about the things that I listed, I hope that like clears it up a little bit for you.
It really does.
Okay.
It really does.
Um, And I wanted to also inform you of a support group that we host here for newly diagnosed patients with HIV. It's a support group. We have doctors and other professionals come in that provide their group with different levels of education so that they can understand what's going on, how they can gain the strength and support they need to like disclose their status with their loved ones and their close relatives. We discuss stigma and a large variety of other things. And um, a lot of people who attend the group now have had great outcomes. They've met new friends, or some people just have come and have been able to connect and have conversation with other people, and feel a sense of like motivation and support. Is that something you think you would be interested in doing?
I think I'm not I'm not not I'm not against it. I just want to think about it somewhere because I'm still like kind of shy, I guess, about coming out to everyone. Even though I understand that everyone in this group has the same diagnosis, I don't know if I'm quite ready for that yet. But it's not something I don't want to consider possibly.
Okay. Um, so would you say the face-to-face component, and like being amongst these people like in the same room is the most like challenging part of being committed to a group at this time?
Possibly, just because and I understand that I guess for the most part that this group should be a safe place, but I don't know like me and you one on one that's one thing, but like you just really don't know what people's motives is, and I just don't want to give anybody that over me right now.
Okay. Um, how would you feel, or would you even consider a support group that's like online? Um, where it's like private. So it's like everyone is on there, they're together. We have the cameras off. We use like aliases, no real names, no real characteristics or details about specific individuals that disclose who they could be or things like that. Is that a something that you may consider?
Yes, that seems more of a safe place right now.
Okay. Okay, so let's jump back to the thought log really quickly as we get ready to wrap up the session. Um, would you be able to come in next week for another session? Is that something you look forward to, or
Yes.
okay? So, today's homework can consist of, or this week's homework up until you return, we can discuss ways to log your thoughts and coping skills.